Hello, my name is Bethany Heck-Gauthier, and I'm here with Seye Abimbola, Associate Professor at the School of Public Health at the University of Sydney, who's going to share with us some thoughts on the role of reflexivity in academic promotion processes. Dr. Abimbola, thank you for being with us here today. And I wonder if you can just start off by sharing some high-level thoughts about the role of universities in promoting collaborative equity.
Thank you very much for having me. When I think about universities, I think first about students. And when I think about the kind of change we want to see in global health, I think that it's still in the future in some way, which means that the students we are training today are the ones who will likely bring that reality into being. Now, the challenge for doing that is that the university as it is continues to model for the students the current realities. In other words, it's hard for students to imagine an alternative reality if the system within which they are being trained and the people to whom they look up to are a particular way, which makes it difficult in many ways. And whenever I'm really sad about the potential for real change to happen, I'm sad precisely because of the kinds of people students are constrained to look up to, because they, in many instances, have themselves been shaped by the culture of the university, the culture of the field in which they work, such that there is a perpetuating loop somewhere there that needs to be broken. And it's we often focus on people who are sort of affected by a reality to sort of ask them to change things, but very often things need to be changed at a higher level. And so I believe that universities' systems of incentives, systems of hierarchy and privilege and preference need to be altered if the academics who work within there are going to have the free space to do what is right, which also for me flows further to the students who study there, being able to find themselves in a position that they are looking up to people who are doing the right things, or at least modeling the right things for them, so that they can actually bring about the change that we need to see in the field.
Thank you for that. And can you tell us a little bit more about what reflexivity is and why it's important for global health equity?
Now, in global health, we do global health from a position of privilege. It is, by its very definition, a practice that involves intervening, working on behalf of people who are less privileged than the person intervening is, or the people are, which means that we come to the work that we do with a certain degree of ignorance about the realities of the people we're working with. And for me, reflexivity basically means critical self-reflection, which is that you're able to deeply think about, introspect in relation to your position, so you know exactly what it is you're doing and in what ways that thing you're doing may be suboptimal because of your position. And then to work hard after having realized that to make sure that you create the conditions you do your work in ways that limit the potential of your position to undermine, in many ways, what it is you're trying to do. So that for me is what reflexivity is, and that's its critical self-reflection in that way. Now, another way of saying what I've just said is that as people who are working at a distance, at a remove, because of power and privilege, but also because of many other things, including just geography. Sometimes we are working from a high-income country, and the people we are working with are in a lower middle-income country. There's geographical distance. There's also various forms of social distance, which could exist within a particular space or across spaces. It could be language, it could be culture, it could be religion, it could be income, it could be many other things. Now, those circumstances then mean that there's only a slice of the reality of the people we're working with that we can truly, fully appreciate. And I like very much the very ancient metaphor of the elephant and the six blind or blindfolded people. And I'd like to think very often that we are just one of those six. Very often there are 5 other positions that we are not at. And the people who are within that system, within that reality, are those 5 other positions. And if if they could talk among themselves, they will figure out what our position is. In other words, we are much, very, much less consequential than they are to understanding their social realities. Which means again that understanding that distance and that knowledge gap and what it means for our ignorance is for me a very central element of being reflexive.
Thanks. And do you have some thoughts about how we could incorporate reflexivity into the promotion process and what impact that could have on collaborative practice?
So academia is extremely competitive. Even in situations in which the system hasn't asked us to compete, we compete. It just goes to show just how much it's been sort of woven into the fabrics of our brains and minds that we are here to run a race. And what that does to us is that we optimize excessively for the things that can be counted, for the things that can count toward a sense that we are winning. And very often the things that count towards the sense that we're winning are the publications we get, the positions we have on those publications as authors. It's the grants we get. It's the positions we are on those grants that we get. It's the amount of funds that we can bring to our institutions. It's the places and journals in which we publish. There are all these markers of success that have been designed by the system in which we work and that the university system itself exemplifies and promotes and emphasizes. And so if you have a global health researcher who wants to be collaborative, who wants to share resources, who wants to share power and privilege, who wants to do all of these things that I've just reflected on, that being critically self-reflective compels us to do, that person, by virtue of doing the right thing, will not be competitive in the space in which they work, which is the university space. And that goes back to my initial point, that then what happens is that the people who are teaching students who will run things in 5-10 years are modeling a practice in which they are constrained by virtue of the incentive structure within which they work to not share power and privilege, to not support people, to not spend their time doing things that do not contribute to those things that count in terms of competition and success. So that there's a default, as it were, that even those who want to do the right things, even those who know that they are doing the wrong things by obeying the dictates of the system, can hardly do otherwise very often because of the structures within which they operate. They have to, after all, they want to be successful. After all, they've been working all their lives to reach a certain position. After all, they have families to feed. All of these other factors are playing people's lives, such that, to my mind, the most important critical entity that could begin to restructure those incentive systems are universities. If they were to say, for example, that we will give you XYZ points for being collaborative, we'll give you XYZ points for mentoring and sharing power, we'll give you XYZ points for, supporting people to do ABC, we would give you XYZ points for channeling resources to institutions and locations that are much less resourced than perhaps the ones where we are based as academics. If the system says we will do all of that explicitly, then by virtue of that, we're beginning to bring into reality, in fact, that future that we aim, that global health will aim towards. Which also then means that teachers, professors, academics, mentors are able to model those practices for their students, which means that the students are more likely then to bring into reality that different global health.
Thank you again, Dr. Abimbola, for being with us today. We appreciate you sharing your thoughts.